Thank you so much, everyone, for joining us today. This is our Navigating Mainstream Benefits training series, and today is day 2 of our training on SSI and SSDI. Just a quick intro for myself. My name is Carla, and I'm a policy analyst at Homebase. I think many of you are very familiar with Homebase, but in case you're not, we're a nonprofit technical assistance provider. So we provide technical assistance for homeless response systems all across the nation. And we work really closely with Santa Clara County's Office of Supportive Housing. And so one of the many things that we do within that scope of our work is to bring you all trainings on behalf of OSH, including this Navigating Mainstream Benefits series that we do every year. So we're constantly looking to improve our training. So at the end, you'll see me pop in like a feedback form link specific to today's training. It really helps if you fill that link out, and it only takes a couple minutes. And for next year, when we bring this training back, we'll make it even better and more targeted towards what you all need and want, so you can better serve your clients. So just a little preview. So the next training for the Navigating Mainstream Benefits series is going to be a training on WIC and General Assistance. So that'll be together. It'll be an 1.5-hour training. So we're still kind of working to finalize those dates, but it'll hopefully be happening sometime in mid to late October. So I will be sending an announcement for that to the SPN and CoC listserv. So you'll see that pretty soon. So just some Zoom housekeeping things. I know everyone's super familiar with Zoom. You might be burnt out by Zoom at this point, but I do like to go over this for just to, everybody be on the same page. So we do have a live transcript function that's available. You can actually enable that in your settings on your screen. I know some folks already have done that. Let me know if you have any issues doing that. We're going to utilize the chat box throughout the presentation for questions and comments, and we'll have Rachel monitoring the chat, and so will I. So if you have any questions, please feel free to utilize that. If you have any tech issues, please feel free to direct message me here on Zoom. If you get kicked off of Zoom and you can't get back on, or you're having issues getting on, you can actually just email me at carla@homebaseccc.org, and I will be monitoring my email throughout this training. One thing I do want to say about questions kind of upfront is we're going to ask that folks, I know that a lot of you are obviously working directly with clients who may be like encountering challenges and accessing benefits and everything. And we're asking that folks kind of refrain from asking questions that are super specific to specific client cases. And the reason is because, there's obviously a lot of details that, for example, Rachel and Asha would need to know in order to provide you with the best information. And it kind of takes away from time from other folks asking questions that might apply more generally to the group. So if you have general questions, that's great. But if we ask that folks sort of, kind of don't ask very specific client questions. So that way we can make the most use of our time. But if you aren't sure if that is the type of question that you're asking, just feel free to ask it, and we can clarify that once you ask. All right, so just to get folks warmed up, quick icebreaker. If the chat box is accessible to you, type in your name, your organization, and what's a part of your daily routine that you look forward to every day. A part of my daily routine that I look forward to every day is having my coffee in the morning. It's like a little ritual that I have, and it's great. So with that, I will go ahead and pass it to Asha and Rachel to begin our training.
Hi, good morning, everyone. So my name is Asha Albuquerque, and I'm a staff attorney at the Law Foundation of Silicon Valley. And we're here to present today on navigating mainstream benefits, SSDI and SSI. And this is part 2 of our presentation. And I'll pass it to my colleague, Rachel, to introduce herself. I think Rachel's off camera, but she's here as well.
I am here, and I'm so sorry. I've been having computer difficulties that I am working on. My name is Rachel Mino. I'm the supervising attorney with the health team, one of the 3 programs at the Law Foundation of Silicon Valley. My pronouns are she, her, hers. And I've been with the Law Foundation for about 8+ years in my current, for this period of time. And then I was with the Law Foundation for about 2 years prior to that, back in the early 2000s. So like 10 years with the Law Foundation. Thanks for having us today, everybody.
Yes, and thanks for having us. So Rachel and I are from the Law Foundation of Silicon Valley. We can go to the next slide and we'll just give you a brief intro on our organization. So the Law Foundation provides free legal services in 3 subject areas, including health, housing, and children and youth. And Rachel and I are from the health program. And so we can just give you a brief introduction on that. We provide legal services to people living in Santa Clara County, living with mental health disabilities or physical health disabilities. We help these people and provide legal services in a variety of areas, from representing patients in psychiatric hospitals on involuntary holds. Today, we're talking about public benefits. So our public benefits program focuses on helping people obtain and get benefit eligibility for programs such as Social Security, so SSDI, SSI, which we went into in part 1 of the training, as well as we can help clients obtain benefits and maintain eligibility for Medi-Cal, for general assistance, for CalFresh, and for a number of other public benefits available on the local, state, or federal level. So next slide. So I'll just go into a brief roadmap in our training today. So in part 1, we talked a lot about initial eligibility, which involved how to determine if someone's eligible for SSI or SSDI. We talked about how to strengthen a case, the application process, and the appeal process in part 1. So today's presentation is really the second part of obtaining and maintaining SSDI and SSI benefits. So we're going to focus today on post-eligibility issues. What happens when your client has SSDI or SSI? And then there may be a number of issues that come up once someone is getting benefits. So we'll talk about the health insurance to which an individual is entitled to once they're on either SSDI or SSI. We'll also talk about representative payee issues. So like a representative payee happens when Social Security has determined that someone's unable to manage their own benefits. We'll consider how a person's living arrangements can affect how much they receive in SSI benefits. We'll discuss what happens if a person is on either SSI or SSDI and becomes incarcerated, since many of you may have questions about that. There are also going to be discussion about what happens when someone's working and getting SSDI and SSI, and how work impacts their receipt of benefits. We'll also talk about another major issue that comes up with clients a lot, which is overpayments, which can happen with both SSDI and SSI. So we can now go on to the next slide. Before we begin, as I mentioned in part one, Social Security has a lot of complicated rules. It's a frustrating and confusing process for lay people and even for lawyers. You don't have to memorize all the information we go through today. You'll get a copy of the slides, and our goal is to give you an introduction, give you a lot of information so that you can identify issues when they come up and know when to refer clients to the Law Foundation for help. And so we'll give you a lot of pointers today and help you with your issue spotting so that you can recognize when a client might have like a post-entitlement issue and say, oh, you know, I've seen this before, and you can refer back to these slides or refer to the Law Foundation. And then, as always, interacting with Social Security can be really complicated. They use a lot of jargon, technical, and confusing terms. The bottom line is, if your client gets a notice or letter from Social Security that they don't understand or you don't understand, or your client has some kind of other issue with their Social Security payments, we're here to help. While interacting with Social Security can be difficult and it's not something we can necessarily fix, we can give you a lot of pointers and helpful tips that can make the process easier. So we can go on to the next slide. Thank you. This exciting part in today's presentation is if you're in this situation where your client was approved for benefits, it's wonderful, but there may be a number of post-eligibility issues that come up. And that's something we'll talk about today. We can go to the next slide. And we'll talk about insurance tied to the receipt of SSDI. And then in the next slide, we'll go into SSI and insurance. So as some of you might remember from the previous presentation, SSDI is Social Security Disability Insurance. And when someone becomes eligible for SSDI, they do get Medi-Cal, but unfortunately, Medicare. Unfortunately, the Medicare does not start as soon as someone's entitled to SSDI. There is a 24-month waiting period. So what that means is an individual who becomes eligible for SSDI, then they only become eligible for Medicare 2 years after the SSDI entitlement. So that can be a hard thing for clients. They're getting, the SSDI, but then, they have to wait 2 years to actually get on the Medicare. And sometimes that time frame can be longer. If you imagine a situation where someone isn't immediately approved for SSDI, like they apply for SSDI, they get denied, then they appeal and do a request for reconsideration, get denied again, and then they have a hearing with an ALJ and finally get approved for SSDI. Then the Medicare will kick in, based on when the 2 years from when they got the SSDI began. So that 24-month waiting period might have already run its course. If someone's, going through all the appeal process, and then maybe the ALJ says they were eligible from SSDI back in 2021, the 2 years might have run their course and they might be eligible for Medicare now. You might also have a situation where a client applies for SSDI, and then they get approved for SSDI just a few months later because their initial application was approved. That client will have a waiting period before the 24 months ends and the Medicare starts to begin. So another facet of this that makes it a little bit complicated is the entitlement to SSDI has a waiting period. There's a 5-month waiting period to get SSDI. after the date of the onset of the disability. So you can see in that second bullet point, an individual is really entitled to Medicare 2 years and 5 months after the onset of the disability. So that, waiting period kind of figures into the when the Medicare begins. And then now we'll talk a little bit more specifically about Medicare Part A, B, and D. I just wanted to flag that Rachel posted in the chat. There is a bill in Congress to eliminate the 5-month waiting period. So if that does become law, that would be a huge benefit for many clients because then, their benefits would begin with the disability onset time. They wouldn't have 5 months of not getting benefits. So now we can talk more about Medicare. If you have any questions, I know this waiting period and when Medicare begins and ends can get a little bit complicated. So feel free to, if you have any follow-up questions, to ask them in the chat. So the main takeaway is that Medicare doesn't start automatically when SSDI, but that there's a waiting period, and that can be upsetting to some clients. So now Medicare Part A is hospital coverage. So an individual becomes eligible for Medicare Part A 24 months after SSDI entitlement if the person is fully insured, meaning they've worked a full 40 quarters. And then so they're eligible for Medicare Part A at the full insured at full insurance. And then their Medicare Part A is going to be free. It'll come at no cost to them. However, if an individual is on SSDI, but they have fewer than 40 credits or fewer than 40 quarters of work, there's going to be a slight premium for those clients. And so this slide kind of spells out the premium. Like if they're not fully insured, there's a premium of $278 per month for people with 30 to 39 work quarters. And then if someone has fewer than 30 quarters of work, there's a premium of $506 per month. And then a deductible may also apply. These premiums change year by year. They sometimes, go up each year. And Social Security is the agency that decides and looks at how many quarters of work an individual has accrued. So they make that determination. So now Medicare Part B is outpatient coverage. Individuals in SSDI are entitled to Part B after that 24-month waiting period as well. And they typically have to pay for Part B regardless of how many work quarters they have. And then the premium is listed on the slide. So they typically have to pay a Part B premium of $164.90. And a deductible may also apply as well there. And then Social Security typically takes the amount of the Medicare cost right out of a client's SSDI benefits. So that can help. They don't have to make a separate Medicare payment on their own. It's typically taken right out of their SSDI benefits amount. So you might see like if a client's entitled to X amount, like $1,500 of SSDI, they'll get, less than that when the amount of Medicare Part B coverage is deducted by the Social Security office. And the Social Security office works with the Center for Medicare Services, also known as CMS, to make sure that these Medicare premiums are paid, that coverage is provided. So now we can talk about Medicare Part D, which is also known as like the prescription drug coverage, which again, has that 24-month waiting period, which we talked about. after the SSDI entitlement. So there typically is a premium associated with Part D, and the amount of the premium really depends on the plan that the individual purchases. Since there are different plans for prescription drug coverage, and an individual can pick out which plan they want to go with in order to have like the coverage they want for their prescription drug needs. So I just kind of gave you an overview, but just so that you're aware, all Part A, Part B, and Part D deductibles may apply. And this is just kind of a brief overview on the scope of coverage, but clients might have more complicated questions about this, and so we can go on to the oh, and then before I go on to the next slide, I wanted to flag that people who are low income may qualify for state-sponsored Medicare savings programs, which would pay, Part A and or Part B premiums and deductibles. So this can be really helpful for a number of clients who are wanting to get assistance with some of these premiums or Medicare. If they fall below a certain income threshold, they can get assistance with that. And they can, apply for that program. And to do so, we encourage individuals to contact like the local county social service agency to get the application started for state sponsored assistance to help with these Medicare programs. And so then we can go on to the next slide. Oh, and sorry, just before I get into SSI, I wanted to share that if you have clients with more like complicated insurance questions or wanting to know more about them, which Medicare plan is best for them, we often refer them to an agency known as SourceWise, which is based in Santa Clara County, and they run a health insurance counseling and advocacy program. So this is a great referral if you have clients who are eligible for Medicare and they're not sure which plan to choose, or they want to compare deductibles or co-pays. Clients can get a lot of assistance with SourceWise and either make an appointment or call their offices to meet with a specialist about different plans and pros and cons. Okay, so now we can talk about insurance tied to social security, SSI, to Supplemental Security Income benefits. So unlike SSDI, there's no waiting period for insurance when individuals are eligible for SSI. And this is a really nice benefit. Insurance tied to SSI is a little bit easier and less complicated to understand. An individual who is eligible for SSI is automatically eligible for and automatically enrolled in SSI-linked Medi-Cal. This is a really nice process because it happens from the moment they become eligible for the SSI benefits. There's no waiting period. Also, another benefit is individuals who become eligible for SSI, they don't have to apply for Medi-Cal on their own. Instead, the Social Security Administration will notify the county social services, and the Medi-Cal application will get started and approved. And Medi-Cal coverage will begin the same month that the SSI benefits begin. So the main takeaway is if your clients are getting approved for SSI, they'll also get approved for SSI-linked Medi-Cal at no share of cost. And again, if you have any questions about like the Medi-Cal or the SSI, you can post in the chat as well. Okay. So now we've discussed the first topic, which is health insurance tied to SSDI and SSI benefits. So hopefully that's provided some clarification on what types of health insurance your clients might be entitled to once they receive their benefits. So I now want to talk about another issue, the idea of representative payees, and we can go on to the next slide, please. Yeah, so representative payees, this happens when Social Security decides that a beneficiary, for instance, like a person receiving SSDI or SSI benefits, is incapable of managing their own benefit payments. So in that instance, Social Security will decide that the individual needs a representative payee, someone who can receive and manage the benefits on behalf of the client or the entitled party. Social Security might decide that a benefit recipient is incapable for physical health reasons, or maybe they have a mental health condition or a cognitive disability that means the individual can't manage their own benefits. And if that is present, Social Security will make a decision that a representative payee must be appointed to manage that person's benefits, like if they're unable to manage it on their own. And so what we often recommend to clients or beneficiaries who've been awarded benefits, and for the people who are required to have a representative payee, is that they try to find a friend or family member to serve as a payee. And this can be helpful because generally, oftentimes, like a friend or a family member will be willing to be a representative payee at no cost to the individual. And that means they wouldn't have to lose some of their SSI or SSDI income on the cost of having someone manage their benefit payments and doling it out. A representative payee would help a client pay their rent, would give them money for personal need items or food or things like that. So it can help to have someone the client already knows, like a friend or family member who wouldn't charge the client for doing that service. But if a client does not have like a friend or family member or someone they know who is willing or able to serve as a representative payee, in those cases, Social Security will look for a qualified organization to act as the representative payee. And this organization would act on the claimant's behalf. But unfortunately, they take a monthly fee for serving as a representative payee. And then unfortunately in San Jose, there's really just one representative payee organization known as Benefits Management Corporation. You might have heard them be referred to as BMC. They typically charge the beneficiaries they're serving. I think when we last looked, they were charging around $40 a month to clients to manage their benefits. And that amount of money comes out of the client's SSDI or SSI benefit and goes to BMC. And then after they withdraw that $40 fee or however much they charge, then they use the remainder to help the individual they're serving for manage their payments. For example, pay their rent, take out money for personal needs and things like that. So yeah, the takeaway is having someone the client knows, like a friend or family member, can usually be the best situation. But if a client has nobody, then a benefits management corporation could serve as a representative payee. So now we can go to the next slide and talk more about what a representative payee does. So representative payee can do a number of services that I mentioned a little bit. They receive the benefits for the client. They pay for the client's current needs, like maybe their rent or their food or other personal items. They might save for future needs, like if the client wants to buy something in the future, provide spending money. And they're supposed to keep records and report uses of the funds to Social Security, as well as return any overpayments to Social Security. And then, yeah, just another like reminder with SSI, a client can't save up too much. You know, if they save up more than $2,000, that would jeopardize their SSI eligibility. But again, there's a bill being considered in Congress that would, increase the amount of money people on SSI could save. But, we'll see what happens. But for now with SSDI, like there's no concern about saving money. Like clients can, save as much as they wanted and they'd still be eligible for SSDI, unlike SSI. And then Social Security might ask the representative payee, how these funds are being overused. And yeah, if there's an overpayment, like if Social Security basically gave more benefits than the person actually was entitled for, then the representative payee would need to return any like overpayment to Social Security. So there might be times when the representative payee has to negotiate or work with Social Security on behalf of overpayments. But we'll talk more about overpayments in more detail later in the presentation. And yeah, if you have any questions about representative payees, feel free to post in the chat. But, if there are times when a client is on a representative payee, but they feel like they don't need a payee. They feel like they're capable of managing their own benefits. They feel like they have the ability and the capacity to make decisions and keep track of their money and their SSI or SSDI they're getting. Then that client can file a request with Social Security to become their own representative payee. And so, yeah, I think someone had posted in a question about a issue where someone's, keeping a client's benefits. Like if the client has concerns like that, they could request to become their own payee by going to their local security office and then starting the application. And Social Security will process that application, and then they'll consider it. They'll send a request to the client's doctor asking if that person is mentally and physically capable of handling their own benefits. And our office has a lot of helpful info sheets and handouts about what representative payees are, what they do, how a client might request to be their own benefit manager, things like that. So we can provide our handouts to any interested clients if any of you request that or have a client with a representative payee problem. And yeah, if you have more questions about this, feel free to post in the chat. And then, yeah, the doctor would really be the one to kind of review and fill out forms about whether they can certify if the individual is qualified to manage their own benefits. And then, yeah, the doctor would send that form to Social Security. If there are other questions, yeah, feel free to share. But other than that, we'll go on to the next part of the presentation, which is talking about SSI living arrangements. So how much SSI a person receives each month is based on their living arrangements. For SSDI, it does not matter where a person lives. The amount they're getting will always be the same, like regardless if they have like a roommate, they're living with a family, things like that. So it doesn't really matter on their living arrangement unless there's kind of an overpayment or some other reduction. But for SSI, a living arrangement does impact someone's SSI and how much they're receiving. So it's really important for clients that they notify the Social Security Administration every time they're moving. So the SSA can update their living arrangement. So if you have a client that's unhoused and then finds housing and is renting a room, they should notify the SSA. If the client's, living with a roommate and then ends up changing living environments and is now living by themselves, all different kinds of different living arrangements, they should really notify Social Security Administration because SSA looks at, where someone's living, what access to cooking facilities they have to decide how much benefit someone's going to receive. So if a client's living independently and they're not relying on help from anyone else, they're paying their own like monthly rent and they have their own cooking facilities, they're generally going to receive the full SSI benefit rate. For 2023, that benefit rate was $1,133.73. And the amount of SSI goes up a little bit like every year. It's not like completely covering of cost of living arrangements. And sadly, that amount, it's really the same, even though San Francisco might be so much more expensive to live in than like the Central Valley, it's that one rate. If an individual doesn't have like cooking facilities, like maybe they're living outside because they're unhoused or living in shelters, then they would get, a different amount, a higher amount of benefit. So it kind of depends on someone's living situation. Another consideration that comes up is oh, and then just to clarify, independent living, it can mean a number of things. It can mean like living alone. It can be living with other people and paying your fair share. Like if you and your roommate each pay like half of the food and shelter expenses, that might count as independent living or living with a spouse or minor children. As I mentioned before, the rate, if someone's like unhoused and doesn't have access to cooking facilities, they would get $1,251.74 for 2023, because that just kind of takes into account that it can be so much more expensive to have to buy prepared meals or buy food when you can't have any cooking facilities to cook for yourself. And then we're also going to just mention something called in-kind support. So if someone's getting benefits and help, so like if someone's getting help from like a family member and they're paying most of the rent and most of the food and most of the expenses, then there would be a reduction in the amount of SSI a client's getting because of that in-kind support policy. If these rules can be a little bit tricky and can be complicated. So if anyone has questions at any time, again, feel free to post in the chat. But we can go on to the next slide, which kind of explains living in arrangements a little bit more. As I mentioned, if someone's paying less than their fair share of food and shelter costs, like someone else, like maybe a family member is paying most of the food, rent, or utilities, that's called like in-kind support and maintenance. Also, another wrinkle that can come up is SSA will reduce the amount of SSI a client receives if they're in a hospital or nursing facility for 30 days or more. So if a client ends up hospitalized for 30 days or more, it's important to report that to Social Security. And we see that sometimes with our our clients who are mental health consumers. They might be in a psychiatric hospital for more than 30 days on a hold, and that kind of result should be notified to Social Security, as it can affect the amount of SSI a client will receive, and notifying Social Security early helps avoid overpayments later on. So we can go on to the next slide. Yeah, so this slide kind of goes into the in-kind support and maintenance in more detail. And so in-kind support and maintenance is food or shelter costs that someone else pays for someone who receives SSI. And this is not just, food or shelter. It can be, other things like home energy assistance. But home energy assistance payments do not count. Food stamps that are paid by the state do not count. But if a client's living with their mom and their mom's, buying all the groceries and, buying the rent and stuff like that, that would be considered in-kind support. But, someone on a Section 8 housing voucher, that would not be in-kind support. And as well as if a client's family member is paying the cell phone bill or the cable bill or things like that, that's generally not considered in-kind support. So under Social Security Administration's ISM rules, if someone helps a client pay their rent, mortgage, food, or utilities, SSA reduces the amount of their SSI benefits. For 2023, the monthly benefit of SSI for people who SSA finds are getting in-kind support or maintenance, then they're only going to get about $833.89. So this is, a lot less than, the maximum they would be getting if they were not getting in-kind support. And there can be a lot of confusing rules about how much SSI someone is going to receive if they're going to get in-kind support, as certain things are not counted or excluded from in-kind support. But the main takeaway from this slide and this presentation is the general idea that in-kind support or maintenance will result in a benefit reduction for clients. So they should try to report any changes in living arrangements or moves between being housed or unhoused, things like that. We can go on to the next slide. So the next slide has some questions, and I can read out loud the question, and then yes, if someone would like to volunteer, they can, or they can post in the chat. But Joe lives alone in an apartment. Joe's brother pays Joe's full monthly rent of $1,200. Will his SSI be reduced because of in-kind support or maintenance? So I'll give everyone a few seconds to kind of consider that question.
And sorry, you see the chat too. Okay.
Yes. So yeah, good job. I think most of you said yes. And yeah, that is correct. Because that brother that he's paying the full monthly rent, that's something Joe doesn't have. If they were both paying 50-50, if they were both paying an equal share, that would not be it. But since the brother is paying all the rent, and rent counts as in-kind support and maintenance, Joe's amount of SSI will be reduced. And if anyone has more questions, feel free to post in the chat and Rachel will be there to answer. So the next question, Maria lives alone in an apartment with a Section 8 voucher, and that requires her to pay 35% of her income towards rent. She pays her full rent portion on her own using SSI money. Maria's parents pay her cable TV bill. And the question is, will her SSI amount be reduced because of in-kind support and maintenance? So you can post in the chat, or if anyone wants to volunteer, you can. Okay, great job, everyone. Yeah, cable TV, and we talked about on the previous slide about how that's kind of excluded from being counted as in-kind support. So nice job there. And then a follow-up question. What if Maria's parents also pay her PG&E bill or buy her groceries? So I'll let everyone take a few seconds in the chat. Yeah, so nice job there. Yeah, utilities, as we talked about, can be in-kind support and maintenance. And yeah, groceries, when someone's buying, food for a client, that can be in-kind support and maintenance. So it kind of depends, and there are different rules, like calculating how much someone's SSI would get deducted based on that in-kind support. So the next question, Brandon lives with his brother and 2 sisters in a home that his brother owns. The mortgage payment is $3,000 a month. Utilities are $300 a month, and household food costs $600. The total household expenses are $3,900 for 4 people. What is Brandon's fair share of the household expenses? Give everyone like a few seconds. And Rachel will be able to give you all an answer, but I'll give it like another second to give a few more people a chance to type it out. Okay, I know we're getting like a range of answers here. It's okay. I know these questions can be tricky, and doing the math early in the morning can be a little bit tricky. So I'll pass it to Rachel to explain this one.
Sure. And sorry, I'd like to type. Sometimes the typing takes me longer because of my computer efforts, or computer issues. So, the fair share, essentially, for the first question, what is Brandon's fair share of the household expenses? You would add up all of the things that are considered as part of the costs, which include the mortgage payment of $3,000, the utilities of $300, and the household food of $600, which brings you to $3,900. And then you'd have to divide that by 4 people, because there's Brandon, his brother, and his 2 sisters. So 3,900 divided by 4, and let me just pull out my calculator because I can't do that math on the spot, is 975. So his fair share of the household expenses would be 975. And I believe a bunch of people did put that amount in the chat. And then the second part, will Brandon's SSI be reduced because he's receiving he's receiving in-kind support and maintenance? Only if he pays less than $975 a month towards the total costs. So if he pays $975, he will not have his SSI reduced because he's paying his fair share of the mortgage, the utilities, and the household food food costs. If he pays less than $975, then he would need to report that to Social Security, and his SSI benefits would be reduced, because if he were paying less than $975, he would be receiving in-kind support and maintenance from his siblings, and therefore be entitled to less in SSI money. And I also just wanted to clarify, I know there were a couple of questions about hospitalization and how that impacts a person's SSI, and my understanding had been that if you're in the hospital for 30 days or more, then you lose your SSI. But I did some research because I was a little troubled and concerned about that. So I did clarify and amend the answer in the chat. And it does show that Social Security has some more lenient regulations. So essentially, if a person on SSI is hospitalized for 90 days or less, they can get a doctor's note stating that the person will be hospitalized for that period or less, and no longer than 90 days. And somebody will need to sign a statement as well, saying that the individual needs to continue receiving their benefits for those 3 months in order to maintain their housing. And in that case, a person can still get their SSI benefits if the hospitalization is going to be less than 3 months. If it's going to be longer, then there is the jeopardy or potentiality of losing SSI benefits, or not losing, but having your SSI benefits stopped until the person is no longer hospitalized. Thanks.
Great. Yeah, thank you, Rachel, and thanks everyone for your great questions. So now we can move on to the next slide, where we'll talk more about incarceration and how that impacts a client's benefits. Oh, sorry, I think I'm off a slide. So yeah, before we talk about incarceration, we'll talk about continuing disability reviews. So my apologies about that. I think we had mentioned this briefly in part 1, but SSA conducts some continuing disability reviews approximately every 3 years. And this is just to see if a person is still meeting the criteria to qualify for their mental health or physical health disability. Social Security may do these reviews more frequently if they think the disability is expected to improve. So what they'll do is they'll notify a client by mail that they're reviewing their disability, and a client will have to fill out new questionnaires, new forms, including like the disability report, a function report. Some of those forms they filled out with the initial application, like including their health conditions, their symptoms. And there are 2 levels of appeal, similar to an initial application. Like a client can get denied, do a request for reconsideration. They could get denied again and request a hearing in front of an administrative law judge. And Law Foundation does take on, cases for clients who need help with appealing continuing disability review decisions. So that's always something you can refer to us if needed. Next slide. And then if Social Security determines that a client's disability has ended, they'll send a written notice of disability cessation, which basically means that they think the client no longer qualifies for disability and that they're going to stop the benefits. So it's really important to flag the deadline for this. The deadline for appealing is pretty short. For a client to appeal and then to continue to receive benefits while the appeal is pending, they have just 15 days to do so. And then actually, like, the deadline is really 10 days, but the Social Security Administration kind of gives an extra 5 days to count for the time it takes to mail the notice to the client. So do everything possible to help that client submit the appeal within these 15 days to avoid a lapse of benefits. Good cause for late filing is allowed. So maybe the client had some kind of emergency or was really sick. They might have a reason for appealing beyond those 15 days. But, with good cause, there may be a lapse in benefits, but you can always refer to the Law Foundation if your client needs help with filing a late appeal of a disability cessation decision, and we're here for you. But otherwise, in other types of decisions, like in part 1, we talked about appealing, denials of like an initial application of Social Security. In that case, in general, the deadline is 65 days. So they have more time to appeal those types of decisions. But with disability cessation cases, it's a really tight time frame, just 15 days. So that was the main takeaway there. Thank you. Next slide. Okay, so now we're going on to incarceration and SSDI benefits. I know this can be very disappointing for many clients and for many people in the community, but unfortunately, SSDI and SSI payments are not payable for the months when an individual is incarcerated in county jails or state prisons or federal prisons. So what happens if a client receives SSDI benefits? The benefits will be suspended if they are convicted of a criminal offense and sent to jail or prison for more than 30 continuous days. And that can be helpful if it's if a client's in jail for just a short amount of time, like it's not a whole month, maybe they're just in jail for a couple days or a week, then their benefits would not be suspended. It has to be more than 30 continuous days. Also, pre-conviction incarceration wouldn't count. But incarceration for probation and parole violations do count from the date of the order revoking probation or parole. So that is something to kind of keep in mind, that depending on if this applies to your client. And if anyone has questions about incarceration and how it impacts benefits, feel free to post in the chat. And Law Foundation also has info sheets on this, and we do a clinic at Reentry in Santa Clara County twice a month as well. So we sometimes have questions from clients who've been formerly incarcerated and are wondering what they can do to get back on benefits. So a client's benefits can be reinstated starting with the month following the month of their release. So, if they're released in, August, they could try to get reinstatement in the month following in September. But though clients cannot continue receiving SSDI benefits while they are incarcerated, their spouse and their children will continue to receive benefits as long as they're eligible. So I'll just pause there for a moment just to give anyone some time. If they have questions, you can do so in the chat. And then the amount of time someone's been incarcerated for can affect when the reinstatement process. So we can go on to the next slide to kind of go over this in more detail. If a client receives SSI benefits, their benefits are suspended if they're incarcerated for a full calendar month. But unlike with SSDI, whether a client is convicted doesn't matter, unfortunately, and then their payments can be reinstated in the month they're released. But unless the incarceration lasts for 12 consecutive months or longer. If a client is incarcerated for 12 months or longer, they unfortunately generally have to reapply for SSI benefits. They can do that through the process we talked about, like going to the SSI field office, or filing through some of the ways we mentioned in part 1. But if it's less than 12 months, typically the payments are reinstated in the month they're released. So it's important for the client to tell Social Security about when they were released, when they were incarcerated, and provide documentation of the dates of incarceration. They can request records on those dates from the area, the county or the jail they were incarcerated at. So that can help clients with beginning the process to reinstate their benefits. When clients are incarcerated and released, the main takeaway is the timing does matter. Like if it's less than 12 months, you wouldn't necessarily need to apply. But we do get a lot of questions of clients just wondering about the process or having problems after they're released from jail or prison. So feel free to refer any of those issues to the Law Foundation, or again, ask questions in the chat. So we can go on to the next slide. So now there's time for questions. So anyone can unmute, and Rachel will be there to answer questions.
You can also continue to put them in the chat if you feel more comfortable.
Hello, can you hear me?
Yes, yes.
Hi, my name's Amy. I was just wondering if someone is applying for SSI, but they're actually better suited for SSDI, are they able to, somehow transfer over to SSDI, or would they have to go through the whole process over again for SSDI?
No, typically what happens and what we recommend clients do is to ensure that Social Security is vetting them for both when they apply. So what Social Security should do as a best practice, and typically does, is when somebody applies, that they should really take a look at that person's application and determine if they're eligible for either of those benefits. However, if you do have a client who's saying, I'm going to go apply for SSI, sometimes Social Security will just take the SSI application and not investigate whether that person is eligible for SSDI. So in that case, I think it depends on where the person is in their application. But if somebody's applying for SSI and for example, that they have a lot of work history, and so therefore have probably paid into the system, the insurance system, quite a bit, and could potentially be eligible for SSDI, which would warrant them maybe more benefits depending on what their earnings look like, then yes, I would tell them, call Social Security, make sure, they know, yes, you applied for SSI, but they should be evaluating you for SSDI as well. But even if somebody just applied for SSI, Social Security should open up that person's work history and take a look and say, well, gosh, they're applying for SSI, but they've got X amount of 40, they have 40 quarters of work. They should seriously be eligible for SSDI as well, assuming they meet the disability criteria, and should be vetting them for both. But it's never a harmful thing to give Social Security a call with the client, or have the client call in and go, actually make sure you take my application and treat it as an application for both SSDI and SSI.
Thank you.
Okay, if people continue to have questions, put them in the chat. I'll read this one out loud just because we're still doing kind of live questions.
Rachel, I'm not sure if we lost you, but if you're talking, we can't hear you.
So Social Security will pay that person out both their SSDI allotment plus the difference to make up for the full SSI rate. So if the full SSI rate is $1,133.73 and the person's only getting $500 in SSDI, they will get the remainder of their benefit. Oh, I'm sorry, my internet's connection is unstable. Hopefully you can still hear me. They will get both SSDI plus the remainder in SSI benefits. So at the very least, their rate is at the full SSI rate of $1,133.73. And that is the scenario where you could get both. So yes, when clients come in and they're on SSDI and SSI, it is because their SSDI is lower than the full SSI rate, and Social Security is giving them the rest of the money in SSI benefits.
Thanks, Rachel. Yeah, somebody had written in the chat, we only heard about half of that because I think you did disconnect a little bit. I think you sort of summed it up at the end, but if folks have any more questions about that or something was unclear, please let us know.
I'll answer in the chat now and let Asha go back to the presentation. I'll put what I said out loud.
Thank you. So we can go on to the next slide. So working while receiving SSI or SSDI. So we can talk more about this because a lot of clients come up with questions like this. You know, what do they do if they start working, and how does that affect their benefits or their eligibility? So eligibility for SSI or SSDI is based on the inability to engage in substantial gainful activity, which was Rachel was talking about a moment ago. So kind of in basic language, that basically means if someone can earn $1,470 or more per month through employment, SSA thinks they're not disabled. And this amount for substantial gainful activity, it's the same, across the country, in every different city or state, despite, some areas having, higher minimum wages than others. So, a client might just be working, part-time, not that many hours and be over the $1,470 a month threshold. And if they are, SSA would think that they're not disabled. However, SSA does provide certain limited protections and policies and programs to encourage people to try working, to see if that's something they can do, even with their disability or their health condition. So we'll go through some examples of, working while disabled programs and things like that. So we can go on to the next slide. Yeah, so SSI has return to work rules where SSI payments will be reduced by the countable income. And SSA has this complicated calculation for how they define countable income. They have you take your gross monthly earnings and then subtract $85 and then divide that amount by 2. So we can go through an example of how that, works in practice, like a hypothetical. So if a client is making $500 per month at work, you look at the 500 and then you subtract the $85. So then you have the 415 and then step 2, you divide by 2. And you get $207.50. So that's the amount of money which their monthly SSI payment will be lowered by. So they're instead of getting, the total SSI they would have been getting, that's lowered by $207. So like if they were supposed to be getting $1,040 and you subtract the 207, then they would be getting like $832.71, but unfortunately SSA rounds down, so they're just getting $832 a month instead. So yeah, clients have to kind of weigh the pros and cons of them working, and just, recognize that money they earn from their work will be calculated and reduce, it will reduce the amount of SSI payments they're getting. However, because SSI checks are sent 2 months after a client earns the SSI, the SSI check will be reduced like 2 months later. So if you have, a client that's making that $500 in, September, it would be their SSI check for September wouldn't be reduced yet, because Social Security hasn't processed that and hasn't done the calculation. It would be 2 months later, like their November amount of SSI would be reduced then. And sometimes clients work for just 1 month and then don't work the next month. So it always gets calculated with that 2-month delay. And again, if anyone has questions on the SSI return to work policies, feel free to go through them in the chat, and Rachel will answer. But this basic takeaway is that work does reduce someone's SSI check, even if they're working less than the substantial gainful activity amount. Okay, so we can go to the next slide. So how does a client report wages? So if a client is working while receiving SSI, it's really important that they report their gross wages for the past month by the 10th day of each month. So if you have a client that was working, for like $500 in September, they need to report those gross wages by, October 10th, the 10th day of the next month. So and as Social Security will adjust upcoming payments accordingly. However, late reporting can cause underpayments, can cause overpayments. It can just make things complicated. So what we recommend doing is that clients report their pay stubs, and they can do so in a number of ways. They can take their pay stubs in person to their local Social Security field office. They can report their wages on the Social Security smartphone app. So there's like a little screenshot of the how to download the app on the slide. They could install it on their phone. So yeah, there are a number of ways clients can report pay stubs. We have one client that faxes their pay stubs to Social Security. But, just the main takeaway is that it's really important for clients to do this pay stub notification, as well as if they stop working, then their wages would no longer, their benefits would no longer be decreasing from that amount of income from their work. So it's in their best interest to report that they've stopped working, as soon as possible, just to make sure that, once that a month benefits comes up, that then they're getting the full amount, and that Social Security is not incorrectly withholding income from them because they think they're working when they're not. So we just really encourage all of this wage reporting to be reported to Social Security timely. So we can now go on to the next slide. So here's another hypothetical. Oh, and I think someone had previously asked if they look at like gross pay or net pay. It is gross wages. So with this hypothetical, Tony receives $1,040.21 a month from Social Security, and he's getting SSI. And he decides he wants to try working. So he gets a job as a peer mentor at a local agency. And here on the slide, we've listed his gross wages. Like in January, he's getting $800, in February, $950, in March, $1,000, April, $1,300, and so forth. So we now have 3 discussion questions. So if anyone is there like a brave volunteer and wants to unmute and speak out, you're most welcome. Or if you want to, share what you think in the chat, you can do that as well. But the first question is, which months is Tony entitled to an SSI payment? And I'll pause for like a couple moments so people have a time to consider this. Yeah, so great job. A nice job here. Tony's getting less than substantial gainful activity. In 2023, the substantial gainful activity amount is $1,470, and he's getting less than $1,470 in all the months. So he would be entitled to some amount of SSI in all of these months. So great job, everyone. You were correct. So now the next question is, will Tony's SSI be automatically terminated if he works over SGA? Yeah, correct. He has to report his income change. Otherwise, Social Security won't know about it. And then, yeah, if he's working over SGA, it would take like Social Security about 2 months to kind of figure that in. And then it would affect his benefits 2 months from then. And so the third question is, and yeah, apologies for the typo there, but what if Tony forgets to report all of these wages and doesn't remember to do so until sometime later? What would happen? Yes, correct. So many of you spotted that there would be an overpayment issued because he likely would still continue to get SSI despite him working if he hasn't reported it. Social Security will eventually find out. They'll issue him a letter of overpayment, and that overpayment would need to be paid back, or he might be able to appeal, but we'll talk more about overpayment in detail in a little bit. But yeah, great job, everyone. I think you all did a nice job with these 3 questions and this hypothetical. And if anyone has follow-up questions, feel free to ask that in the chat. And we can go on to the next one. Thank you. So for SSDI, the return to work rules are much more complicated than SSI. There are all these different like nuances and programs that make it a little bit tricky. But this will just give you all a brief overview. And if clients do have like further questions or specific cases, Law Foundation can take on like overpayment cases for clients. So feel free to refer those to us. The SSDI return to work process has several steps. There's something called like a trial work period, something called an extended period of eligibility, expedited reinstatement, an initial reinstatement period, and then, a new trial work period. So a lot of complicated terms, but we'll just take it one step at a time, and we'll go into each one in turn in more detail. So we can go on to the next slide where we'll talk about trial work period. So the trial work period allows a client who's getting SSDI to test their ability to work. So maybe someone's had like a disability or the health condition where they haven't been able to work, but they're interested in trying it out to see if they can make it and still work despite their disabilities. So during a trial work period, a client will receive their full SSDI benefit, regardless of how high their earnings are, as long as they report their work income and continue to have a disability impairment. And they can have this trial work period for up 9 months and, continue to get their earnings from their job and continue to get their SSDI income. So you might wonder, like, when does the trial work period start? The trial work period starts the first month a client earns over a certain amount in gross income. And so, the amount of money that this amount is, this changes every year. So like in 2023, if someone was earning more than $1,050, then that would be considered trial work period. That would be their first month. But last year, like if anyone's still facing an overpayment based on work in 2022, the threshold was smaller. It was just $970. So this amount goes up each year. And Rachel flagged in the chat, the amount of money that triggers the trial work period is not the same as substantial gainful activity. And that's really worth emphasizing. This is a smaller amount than substantial gainful activity. Here the client can work and earn less than these amounts without like any kind of consequence. So in 2023, if a client was just earning like $900, that would not be counted as like trial work period. But as soon as they earn more, or as soon as they earn $1,050 or more, the trial work period begins. So we can go on to the next slide. So how long does a trial work period last? So this is when it gets tricky and more complicated. So the trial work period continues until a client has done 9 trial work months within a 5-year period, within a 60-month period. But these trial work period months, they don't have to be consecutive. So someone might be doing like, 3 trial work period months, like 1 year, and then like 6 the next year, and that gets them up to the 9. So they don't necessarily have to be consecutive, or maybe they were just working, year 1 a couple months, and then year 3 a couple months where they were over that threshold. So it doesn't have to be consecutive. Another thing to highlight is that Medicare eligibility is unaffected during the trial work period. So they can still continue to get their Medicare while they're trying this trial work out, while they're still getting their SSDI. However, depending on, what Medicare programs or parts they're in, like if their income goes up, they might no longer be eligible for certain Medicare subsidies if they're getting certain like state assistance or subsidies for their Medicare. So that's an important implication that might affect clients if their income goes up. We can go on to the next slide. So this slide will give you a hypothetical and some practice in identifying what is someone's like trial work periods, how do you figure that out, and how do you know if someone's accumulated 9 trial work periods months or not. So in this hypothetical, Gina was working in 2023. And just a reminder, the threshold for a trial work period in 2023 was 1,050. And yeah, Rachel just posted that in the chat, so that can be helpful for you. And then the amount she's working for all these months is listed below. So the first question, what are Gina's trial work period months? So again, you can write in the chat, or anyone can volunteer if they like. And I'll give everyone like a few seconds to kind of read through the slide and then, yeah, figure out which months were her trial work period months. And just a reminder, they don't have to be consecutive. Okay. And yeah, I can offer a little bit of a hint to, oh, someone spoke up. What we want to do here, I'll let everyone put in the answer and then we can explain it. And yeah, doing these hypos is just good practice and kind of applying some of the rules we learned and kind of seeing if we know, how this would affect like a client in this type of situation. Okay, so I want to shout out to, I think Isaiah Bone. Nice job. You were spot on. A trial work period is any month where someone is earning over the trial work amount for 2023, which is 1,050. So in January, Gina was earning 1,055, which was over the 1,050 month. In February, she was earning way less than that, so February did not count as trial work. March did count. She was earning over the 1,050. April doesn't count. April, she was under. May, June, she was under. July, she's over. August, she's over. And then finally, December. So the answer here is Gina's trial work period months were January, March, July, August, and December. And those are not consecutive, and they don't need to be consecutive. So if anyone has follow-up questions, yeah, feel free to ask in the chat. But the next question is, has Gina accumulated 9 trial work period months? Okay, correct. Yeah, great job, Pratima, Caroline, and Isaiah. No, she's not done 9 months. She's only really done, I think, five trial work period months. So yeah, this is just an example. If you have clients in this situation and they're wondering, how many months of trial work period can they do and how many months have they done, you kind of look at it on a month by month basis, and then just flagging the work earnings, the trial work period amount changes every year. So in 2024, there'll be a different amount. We can go on to the next slide.
I would just want to add one thing, and I think it's really, really important to track trial work period months if you're working with a client, because Social Security does not track them simultaneously. Mm-hmm. So some Social Security may go 2, 3, 4, 5 years without realizing somebody's hit their trial work period and has been ineligible for benefits for that whole 2 or 3 or 4 or 5 years that they've continued to get benefits. So if you and your client are tracking the trial work period months and you realize, my gosh, this person's hit their 9th trial work period month, notify Social Security of that, because as Asha's going to start talking now about other other things that happen after the trial work period ends. But if Social Security doesn't realize that for 3 or 4 years down the road, it can result in a huge overpayment that could have been avoided if the client is tracking their trial work period months.
Yeah, thanks, Rachel, for clarifying that. And yeah, that's really important to emphasize. Okay, so next on, we're going to talk about the extended period of eligibility. So this is what happens after the trial work period ends. And I know there are all these like complicated terms here, but you'll have a copy of these slides to refer. But the extended period of eligibility is 36 consecutive months after the trial work period ends. And these months are counted whether or not the client is working each of these 36 months. And this extended period of eligibility is triggered by the end of the trial work period, by the end of month number 9. And then you keep going, you keep counting until you reach month 36. So why does this matter? Because during this extended period of eligibility, a client is going to continue to get their full SSDI benefit as long as their gross earnings, so their earnings before taxes, are below $1,470 a month. And that's the substantial gainful activity amount. Which, goes up a little bit each year. But for each month, within these like 36 months, if a client's gross income is over $1,470, they're not eligible for SSDI during that month. So that can be tricky. That's again why it's so important for clients to report that they're working, report how much they're working, because it affects, whether they're going to get the SSDI or not. And then it also can affect, whether they end up charged for an overpayment later, because if they're getting benefits while they're over SSDI, they wouldn't be eligible for that. And Social Security will find out and charge an overpayment later. But extended period of eligibility can be helpful because it just gives the client more time where they can get the benefits while still working a little bit each month. So we can go on to the next slide to kind of clarify what extended period of eligibility means in more detail. And yeah, it's like an all or nothing thing, like an on or off switch. If they earn above SGA, then you're not eligible for SSDI. And then, but if they're making less than SGA, the light switch is on and they're getting the payments. So we always advise clients to try to keep their wages less than the SGI amount, even less than a little bit less, to give a bit of a cushion to be on the safe side. So to try to keep their gross wages no higher than like $1,350, just to be cautious. But there is a 3-month grace period. So SSDI payments continue the first month earnings are greater than SGA, and then the next 2 months thereafter. So that 3-month cushion kind of means if someone's working over SGA, then they're still getting these SSDI payments at the same time because of this grace period. But if earnings drop below substantial gainful activity again during the 36th month, SSDI can restart, but it doesn't, restart automatically. Like the client would need to report the lower income, that they're not, working that SGA amount anymore. They're either not working at all or working less, and then their SSDI would restart. So overpayments are really common for clients who are in this extended period of eligibility and then working or not working and kind of going back and forth because it takes SSA time to process a client's work activity reports. And the rules are confusing. They're constantly, backlogged with paperwork. So it's common for overpayments to be issued. That's why we recommend that clients keep copies of all pay stubs, all kind of records of their work history, how much they're working, so that they can use that and report that to the Social Security Administration. And yeah, that is correct, the question in the chat. For extended period of eligibility, the amount for SSGA is $1,470, but yet trial work has a smaller threshold amount of $1,050. Yeah, we can go on to the next slide. Okay, so now we have another hypothetical, so you can practice figuring out this extended period of eligibility. So Gina's 9-month trial work period expires in December 2022. In 2023, she earned the following amounts at work. So in January, she was earning $950. In February, she was earning $1,400. In March, she was earning $1,370. In April, $1,400, May, $1,100, and June, $850. So the first question is, what months did Gina go over SGA?
And Asha, I'll just interject here. I think 1350 was the SGA last year. So let's just pretend like 13, because the hypothetical numbers are all based on that 1350. Let's pretend we're working with a SGA of 1350, even though it's 1470 now in 2023. And that's my apologies for not changing that number on this slide.
Okay, and yeah, feel free to volunteer out loud or post in the chat. What months do you think Gina went over SGA? Yeah, great job. I think the few of you that answered were correct. Yeah, in February, March, and April, she was over that threshold. So nice work, everyone. So the second question is, what months was Gina entitled to an SSDI payment?
So think of the light switch. People may be answering in the chat, but think of the light switch. So as long as she was not making SGA, the light switch is on.
Yeah, great job. So people correctly identified that, in January, May, and June, she was not over SGA, and she was entitled to SSDI in those 3 months. Okay, we can go on to the next slide. So now we'll go into expedited reinstatement. We can think again to like the Gina example. If after the 9-month trial work period and the 36-month extended period of eligibility, if Gina's working over SGA, her SSDI will be terminated. At this point, Gina can ask for an expedited reinstatement if her wages drop below SGA at any point within the 5 years after the 36-month extended period of eligibility ends. And so expedited reinstatement is kind of like a new application for benefits. However, it is somewhat faster than an actual new application. But unfortunately, the process can still be lengthy because SSA will do a new disability determination, but they'll use less strict standards. Yeah, so if you have a client that's kind of in that window where she's eligible for expedited reinstatement within the 5 years after the 36 month period of ends, then it can help to do this expedited reinstatement process so that someone doesn't have to do a new initial application. And then while someone is applying for this expedited reinstatement, they can receive up to 6 months of provisional SSDI benefits while the application is still pending. However, if the application process takes more than 6 months, then Gina doesn't get payments during, those extra months while her application is still pending. It's just up to 6 months of provisional benefits. And if Gina's expedited reinstatement is approved, a new cycle of trial work period and extended period of eligibility begins after the 24 months of SSDI payments. And so then that's like an initial reinstatement period. So yeah, that gives you some more information about other ways a client can go through this reinstatement cycle. Okay, so next slide. And then as with SSI, if a client's just getting SSDI, it's still best to proactively report wages to SSA so they can walk those pay stubs into the field office. They can report their wages online via My Account on the SSA website. I think at the time of this presentation, there wasn't an app for SSDI recipients to report wages, but there may be that option in the future. And then also remember to report when a client's work stops. That's really important and affects the amount of benefits they're going to get. Okay, next slide. So return to work, yeah, the bottom line, the big takeaway is clients should report the income when it's earned. Don't try to hide it from Social Security, even if it's under the table or, any kind of work, it should still be reported because Social Security conducts periodic work reviews. It pulls IRS records. They'll find out about all taxable income at some point, regardless of whether a client reports it or not. And if clients are not reporting their work, they could get huge overpayments. We've seen clients have overpayments of over, $50,000 if they haven't, reported their work history. So this has, huge impacts on clients. So do report that. And yeah, as Rachel said in the chat, they can be reported each month, wages before the 10th day of the following month. Next slide. So now I'll pause for questions. So feel free to unmute or type them in the chat and Rachel will answer. Thank you.
Yeah, I've been answering questions in the chat as they've come up. If there are any of those answers that you want clarification on. There's a question, but I forgot if the subtracting $85 rule and dividing by 2 also applies to SSDI. And no, that's for SSI income. When you are trying to figure out, when Social Security is trying to figure out how much SSI a person is entitled to, they will look at the person's income from that month, subtract 85 and divide it by 2, but that does not also apply to SSDI, only SSI. Okay, if there's no questions that people want to speak out loud, that's fine. Keep Oh, how much does the SSI reduced when their earnings are over 1050? So that's a good question and a good point for clarification. So if a person is earning over 1050, and therefore they're hitting a trial work period month, the SSDI is not reduced at all. The person will continue to get their full amount of SSDI. And as long as the person does not use up the full 9 months of the trial work period, the person will continue to get their full SSDI as long as the person is not earning over the trial work period a month. However, if there have been 9 months where a person has earned 1050 or more within a 5-year period, and again, those months do not need to be consecutive, then, and during all that time, they will continue to receive their full SSDI rate. But after those 9 months have been used up, then the person enters the extended period of eligibility, or EPE. But the earning of the 1050 does not impact the actual amount of SSDI they get. They will continue to get their full SSDI amount, even in those months where they're earning 1050 throughout their trial work period. So I think it's a good point of clarification. Income in a given month does potentially have an impact on the SSI amount the person's issued, but it does not have an impact on the SSDI amount as long as they're within their trial work period. Only after they've entered the extended period of eligibility will the SSDI benefits be impacted, in the sense that if they work over SGA, they work over 1,470, then they will not get their SSDI. But if they work under 1,470, and that's gross, then they will get their SSDI. Yes, and so Josephine's question, so essentially for SSDI, you can't get over 1,470 once you're in your EPE, but for SSI, you can go over 1,470, it would just get reduced. That's correct. I think the one caveat though is, no, yeah, that's correct. That's correct. Yes. I think that if you're going over 14, the substantial gainful activity amount is not quite as relevant when it comes to SSI, but yes, if you make over, if your income is if you make any income while receiving SSI, you should report it. And if it's over a certain amount, they'll subtract the 85 as that exemption and then divide it by 2. Okay, I'll turn it back to Asha, and I'm happy to continue answering questions in the chat. Oh, I'll answer this last one. So when would SSI be terminated? Only the do it. Yes. So SSI would be terminated essentially if they did a CDR because they say, oh, you're working and it appears you can continue to work and make a lot of money even over SGA. So they could do a CDR. I think even if a person continues to earn, as long as the person's entitled to some SSI in a month, and within a 12-month period, they're going to continue keeping their SSI case open. So SSI, Social Security treats it as a welfare benefit, a benefit of last resort. So if a person becomes eligible because they're too disabled to work and they're low income and low resource, which is kind of portion of the presentation that we presented 2 weeks ago, then they're going to get on SSI, and their SSI case or their SSI benefits can remain open as long as any time within a 12-month period they are entitled to some SSI, even if it's a reduced SSI, because they're earning a little bit at work. But potentially if 12 months went by where no SSI was issued because the work earnings always negated any type of SSI earnings, then the SSI case could be closed. Or if they did a CDR, the SSI case could be closed as well if they found that the person was no longer eligible after doing a continuing disability review.
Okay, thank you, Rachel. And thanks everyone for your great questions. So we have another section next. Thanks, Carla. So overpayments. We've kind of mentioned this throughout the presentation, but now we'll go into this in more detail. Overpayments can occur for a variety of reasons, but they're situations typically caused when an individual is going back to work and earning more than the substantial gainful activity limit. And then this might occur after a person has used up their trial work period with SSDI. With SSI overpayments, they can be caused by a variety of things, from a client's change in living arrangements. Maybe they're going to from being unhoused to housed and hadn't reported that, or maybe they're having a change in income for another reason, having excess assets. Maybe they left the country country or became incarcerated. So there are a number of different reasons for SSI overpayments. So the big takeaways here, if a client receives a notice of overpayment, they have the right to appeal and challenge the overpayment. And there are three different things they can do. They could file a request for reconsideration if they disagree with the overpayment, believe it's incorrect. They could file a request for a waiver of the overpayment. Maybe they think, yeah, the overpayment was kind of correctly issued, but I wasn't at fault, or I don't have the money to pay it back. They might ask the overpayment to be waived. Or third, they could file a request for a change in the repayment rate. So if clients, have, huge overpayments in the thousands of dollars, maybe they can't afford to pay, a big chunk each month. Maybe they want to pay a smaller percentage back. So they could fill out a request for a change in the repayment rate. And these are different forms or appeal processes that Law Foundation takes on for clients on occasion. So you can always refer to us. But now we'll go in more detail in what each of these is and what deadlines are involved. So we'll start with the request for reconsideration. So with filing a request for reconsideration, the deadline with these types of overpayment appeals and requests is 60 days, with 5 days to allow time for the notice to have been mailed. So generally 65 days. And you can count that deadline from the date on the notice. So if a client got a notice about an overpayment on January 1st, you count 65 days from January 1st, and that's the deadline for them to fill out the request for reconsideration. But of course, with other deadlines, if a client does have good cause, maybe they were having an emergency hospitalization or surgery or something, they could do a good cause for a late appeal request. A request for reconsideration concerning an overpayment can be filed if the client disagrees with the fact that you were overpaid or disagrees with the amount of the overpayment. Social Security will take another look at the reason for the overpayment, and then they'll calculate it. And the client may be entitled to a personal conference, like a meeting with a Social Security and someone that works there to discuss the overpayment. And these conferences can happen by phone or in person. And they give the client an opportunity to just discuss the overpayment, find out more about the reasons. If Social Security denies the request for reconsideration, the client is entitled to ask for a hearing with an administrative law judge. Having a hearing can be a long process. It might take, more than a year for a hearing to be scheduled. But, Law Foundation on occasion does represent clients in these types of hearings. So this is just an overview of the request for reconsideration. Some of you might be wondering, how do you know if a client's overpayment, if it was issued incorrectly, or if there was a problem with it? Some of the previous slides, like trial work period and extended period of eligibility, those are all different tools in your toolbox that you can use to look at to see how the overpayment was calculated and to see if there were any problems with how Social Security did it, or you can always refer to us. Next slide. So the other option we talked about was a client could file a request for a waiver or a request to change the repayment rate. And either of those two things can be filed at any time after the notice of the overpayment. Unlike request for reconsideration, which had that 65-day deadline, there's no deadline to request a waiver nor a deadline to request a change in repayment rate. Clients can file those requests even if they've already started paying back the overpayment. So why would a client want to file a waiver of overpayment? They can be filed if the client is not at fault for the overpayment and they cannot afford to pay back the overpayment. And there's a particular Social Security form that has to be filled out, which asks a lot of questions, including like the client's like resources and income and other reasons that they can fill out to do that waiver request. And then I wanted to highlight if the overpayment's really small, like if it's $1,000 or less, there's something called an administrative waiver, which Social Security grants for those like small overpayments. Is basically it would just be more hassle for them to take it through the appeal process rather than they can kind of quickly do that administrative waiver. And a client can ask for that in writing, and we can help clients with that as well. A request for a change in repayment rate. So that's an instance where clients, paying back the overpayment a little bit each month, and they feel that the rate is too high. So they want to reduce the rate. What they need to do is show Social Security how much they can pay back towards the overpayment based on their income and expenses. And there's a particular Social Security form to fill out for that, available on the Social Security website or in their office. For SSDI overpayments, Social Security aims to collect an overpayment within 36 months. So they'll take the amount of the overpayment and divide that by 36 to determine the ideal monthly repayment rate. But with SSI, Social Security defaults to withholding of 10% of the SSI benefit. And clients actually have that like legal right to just have 10% withheld. With SSI overpayments, so if more is being overheld, they can ask for it to be reduced to that 10%, or sometimes even smaller. Maybe 10% is too high if they're having a high overpayment. Like we see clients sometimes negotiate repayment rates as low as $20 a month. So that can be more realistic for a client to pay if they have other expenses such as rent and food and other things. If Social Security denies the request for waiver or change in repayment rate, a client's entitled for a hearing with an administrative law judge. And again, that deadline's at 65 days. Next slide.
Thanks, Asha. I'm wondering, since we only have 3 minutes left, if we still want to do the hypothetical, or if we want to just move to like the information on the last 2 slides.
That is a great question. It's up to you.
Yeah.
Oh, go ahead, Rachel.
I would vote to maybe do the information on the last 2 slides.
Okay.
So that would be my vote.
Okay, we can do that. When to refer cases to the Law Foundation. As I kind of mentioned throughout, we assist clients with appeal paperwork at both the reconsideration and ALJ stages. We typically do a merit review first, like we review the client's some documents and the reasons involving why they want to appeal. And then we can assist clients with filing the appeal paperwork and then ask them to come back if they're denied and need to request an ALJ hearing. And the same goes for benefits terminations, reductions, or overpayments. You can refer basically all of these issues to the Law Foundation. We can't always guarantee full representation depending on capacity, but we typically do like an initial intake interview and merit review before agreeing to represent clients. And we have different levels of service, including like an advice and counsel, filling out appeal forms, and even representing clients at hearings. Next slide. So now we can go through, I think we were supposed to have a referral slide at the end, but you can always fill out our form. We have a referral form, which just includes some basic information about a client. So you can fill out our online referral form or email healthintake at lawfoundation.org. So I will, so that's on our last slide there. Our email address is there. Our online referral form. Clients can call our intake line, walk in, or come to our hours. So that was all. I know we're at time, but our email and contact information is there if anyone has further questions later on.
Thanks so much to Asha and Rachel. And I'm also posting a message in the chat. I posted the feedbacks form. And also, as always, we're going to be sending out the presentation slides and the recording to the listserv soon. If you had any questions that went unanswered, please feel free to email them to me at carla@homebaseccc.org. And I'm happy to pass those along to Rachel and Asha and get you a response. Sorry, I know we got a little short on time there at the end, but appreciate you all being here and your honest feedback and for being so engaging and asking all your questions. And thank you so much for Rachel and Asha for a wonderful and informative